Hey guys, this is Mason from AR500 Armor, and today I'm going to give you a brief rundown about our IFAKs. A couple points that I wanted to cover today with you guys, just to pass some knowledge on to you. Why an IFAK, first of all right? Then we're going to get into what is in an IFAK. Then we're going to talk about some of the upgrades we have available on our website for IFAKs. And we're going to finish off with placement of your IFAK on both your kit and in your everyday carry kind of situation, all right? So let's get right into it then. Why an IFAK, right? Why should you own an AR500 Armor IFAK? Well, everyone should own an IFAK, all right, but that's just my opinion. IFAK stands for Individual First Aid Kit, right? But it's not like your Red Cross kind of first aid, all right? You're not gonna find Band-Aids in a standard IFAK, okay? It's gonna have trauma essentials. You're gonna have tourniquets, you're gonna have chest seals, you're gonna have bandages, you're gonna have the kind of stuff you need to save yourself in a trauma situation. A lot of people think shootings, and that's a big one. The IFAKs kind of started in the military world and have trickled down a little bit to the civilian world. IFAKs are designed to be used for you, right? The I in IFAK stands for individual. You carry an IFAK on your kit because if something happens to you, you can use it on yourself or someone else can use it on you, all right? So keep that in mind as you're building these kits, okay? What's in an IFAK, right? So let's dive into that, okay? You're gonna get one of our IFAKs. We do two different types, all right? You're gonna have the standard zippered IFAK, and you're gonna have our quick detach IFAK, okay? Contents are gonna be very similar in both kits. All right, let's break it out. Check it out here. You're gonna open the zippered one up. You will find inside one SWAT tee. All right, it's a bandage slash tourniquet. You're gonna find one thing of compressed gauze. You're gonna have a small roll of medical tape. You're gonna have a pair of nitrile gloves, not latex. You're gonna have one H&H thin fold bandage. You're gonna have a Fox chest seal. There are two chest seals in here, right? Because where there's one hole, I always assume there's two. You're gonna have a pair of trauma shears for cutting off clothing. You're gonna have an additional compressed bandage. And then you will also find a hemostatic agent, right? And in our kits, it's either gonna be Celox or Quick Clot. All right, and that's gonna be for junctional hemorrhaging, stuff you can't fix with a tourniquet. And then lastly, of course, you will have the pouch. All right, some of the upgrades that you can get for our IFAKs are gonna be, you can go from a SWAT tee to either a CAT tourniquet, which is the standard issue military tourniquet for most branches of the United States military, or you can go with a soft tee wide, which is also an issued tourniquet in the United States military as well. Keep in mind, guys, these are the only two officially TCCC approved tourniquets in the United States. So just something to think about as you start building your kit for yourself. All right, let's jump into placement then real quick, guys. So where do you want to put an IFAK on your kit? That's really kind of a personal question, guys. Some of you guys coming from military background will know that there's like a unit SOP based on where you want to put it. Like you might have to put it on the left side or have to put it on the right side. As your regular responsible American citizen who wants to carry an IFAK, it's really kind of up to you guys. You want to make sure you keep it in a location that you can still access if you need to. So having it like in the very center of your back might not be a good idea. It's not super easy to get to, especially if you're wearing armor. Somewhere you can access and somewhere that doesn't get in the way of drawing your spare magazines or your reloads or any of your other immediate like first line gear, okay? So you wouldn't really want to put it right here if you're right-handed because then it'd be above your handgun, right? And you don't want it to interfere with you being able to draw your handgun, right? So keep that stuff in mind as you place it. If you guys are just going to carry an IFAK in the regular world as a normal person, too easy. I keep mine in my vehicle. It's a great place to store one. You should always have one handy with you just in case. There's also some other smaller kits you can get if you want to, I don't know, keep it on your person, stuff like that. You can do that. A lot of people now are mounting them on war belts as well. So if that's one of the things that you guys are into, again, keep in mind you don't want it to interfere with any of your other line gear, all right? The quick detach IFAK, let me give you a quick breakdown how that works. You'll attach the back panel of the itself to either your kit or your war belt, like I mentioned before. Then all you're gonna do is grab this handle right here, and you're gonna pull, and it'll actually release the kit like this, right? The whole pouch does come off. So you can put it in a slightly less accessible area and you can still get to all your medical supplies. You'll notice it's got all the same stuff in it. All right, we got your Fox chest seal, H&H thin bandage, we got your Celox, which is your hemostatic agent, compressed bandage, compressed gauze, trauma shears, gloves, and tape. All right, and then all you gotta do, when you need to put it back on, fold it back up, stow it, and you're good to go. Too easy. You guys be sure to head over to our website and check these things out for yourselves. Keep an eye out for any promotions and sales. Be sure to sign up for our emails. And next time we do a promotion on these bad boys, we'll send an email out to you guys and get your hands on them. Otherwise, guys, take care, stay safe, and thanks for watching.